Hello, I'm Monica Garcia of the Los Angeles Unified School District Board of Education, and welcome to Families Matter. Joining me today is my co-host, Pia Escudero, the Director of School Mental Health. Our goal is to provide information so families can help their children graduate and stay safe in school. Today's topic focuses us on the Affordable Care Act, or Obamacare, and what the new healthcare coverage options are for families. We will be joined later by our panel to learn what the district is doing to help keep our families, employees, students, and parents informed about their choices. But first, a chance for us to talk about the latest regarding the LAUSD and families. Hello, Pia. How are you?
I'm great. Thank you.
We had a great day today, cutting the ribbon at 9th Street. So at 9th Street is our campus downtown, and it is one of our schools that used to be 100% bungalows, and we had just a celebration of leadership, vision, good work, and the revitalization of downtown is alive and well in our 9th Street Elementary and our Para los Niños Middle School. And I just love thanking the voters. I love thanking the voters for investing in our schools. So one of our interesting projects are the wellness centers that the voters have also helped us invest in. Tell us about the wellness centers.
Well, it's really exciting. You're absolutely right. The voters allowed us to use joint use bonds to build projects, and we've really set aside a significant amount of projects. We currently have 14 wellness centers with this 9th Street project, where we actually have health and mental health services at sites with a designated strategic plan. Our goal is to really be preventative and really push for communities to be healthy, not to wait until they're very sick. So at 9th Street, along with 13 other sites, we have health practitioners and nurses working together with social workers and really working with students and families to address whether they need sports physical, sometimes we have dental projects, visual projects. So it's very exciting to understand that children need to be safe and healthy in order to learn. And we've actually committed, thanks to the voters and really our school communities, to make these centers viable and where families can visit while they're at school and before going to school. So we're very excited. This is a really good year.
It is. And so many of our kids and families really do need access. Tell us why you think it's important for our schools to be the places where these healthcare services are available.
You know, it's pretty amazing the stories we hear every day at school. Kids show up. No matter what's happening at home, what happened over the weekend, sometimes they're very hungry, or sometimes it's whatever's happening, the bell rings and they are there. But then they may have a toothache, maybe they're not seeing things. And for families sometimes to go into a health provider and wait in line and miss a whole day of school, and because of work schedules, our children don't get access to these services. Right. When we make them part of the school and we have a way for children to leave their classroom, get the services they need with their parents and come back, they're able to learn. They're able to get what they need. And we know that for health and mental health, children actually get these services that they much need when they're close by, and much better in school so they don't miss school.
Right, and that's such an important thing for us. We want our children to be successful in school. We want them to have high achievement. We need them to be able to come to school, right? So we're working on our attendance. And whenever there is an issue, whether it's I need physical attention, or I need to see the dentist, or sometimes I just don't feel well, right? And so some of our mental health. Tell us a little bit about the mental health piece of this work.
It's so important to talk about mental health. We sometimes know what it means to get a shot or vaccine, or when we have a headache, but sometimes talking about I'm feeling a little low, I'm feeling disconnected, or I have an issue that it's keeping me worried, I'm too busy to think about what's happening, to learn and hear what the teacher's saying. Mental health is just as important as toothache or other health issues. And many times they're together. So we know that sometimes we have issues like an anxiety attack that may look like my heart is hurting, or I can't breathe, my stomach hurts. And anxiety is something that we can actually teach coping ways of how to relax, how to breathe better, and how to digest something that may be impacting, and it looks like a health problem, but it's really a mental health. We know that helping our students to think differently changes the behavior, and sometimes the behavior changes the feelings. It's a little triangle that in mental health services, we really work with children at different ages. We work with teachers and we work with parents to teach them that it's just as important to learn preventative coping skills and behaviors to help them before we have a big problem, before you're so sick that you can't come to school, right?
That's right. That's right. And we want all of our families to know our campuses are places for them to come and get information. Today we're going to focus on our Obamacare.
Yes.
We'll be right back to discuss the Affordable Care Act and what the LAUSD is doing to update all its stakeholders. We'll be right back.
Hi, I'm Dr. Espinoza.
I'm Dr. Solomon, a member of SEIU, and we have some exciting news.
This is really fantastic.
Big things are happening.
On October 1st,
New lower-cost healthcare plans will become available on the health insurance marketplace, thanks to the Affordable Care Act.
if you've been trying to buy health insurance on your own and have been unable to afford it,
Found it difficult to compare plans,
or if you couldn't get covered because of a pre-existing condition,
then this is great news for you.
the marketplace means group buying power.
And insurance companies need to compete to earn your business.
Just fill out one application and you can shop for the right plan for you and your family online,
Compare plans and what they cost.
find out if you're eligible for financial assistance that can help save you money,
Insurance plans in the marketplace must offer coverage for
regular checkups, hospital care,
maternity and newborn care,
prescriptions,
and for your kids, trips to the dentist and the eye doctor. You can sign up online, over the phone.
or through the mail.
No plan can turn you away or charge you more because you have a medical condition.
Plans can't charge women more than men for the same health insurance coverage. So fill out the application,
Visit the online marketplace.
pick your plan, and come and see me.
You can sign up starting October 1st, 2013. Coverage starts as soon as January 1st of 2014.
To learn more, go to healthcare.gov. Ask questions, get answers, get covered.
Here at Esteban Torres High School, we're having what's called our Educational Justice Week edutainment event. So we actually have a resource fair going on. We have tours of the Wellness Center so that students can see like all the services that are provided to them. And we also came up with a policy report that takes a look at all the services and like how what students think about the Wellness Center, what they think should be included.
Today we saw a lot of booths about preventing pregnancy, STDs, and mental health care, and I think it's pretty awesome.
We're really excited as Bienvenidos to be able to provide these students with the services of healthcare, primary care, mental health, reproductive health services. We realize that if children are healthy, they're going to perform better in school, they're going to be able to succeed later in life, and so this is the foundation really of their health for the future and in their adult lives.
We recognize that students aren't going to be effective learners unless they're healthy. And that is so critical in our community that young people have access to healthcare services that are quality, that are affordable, so that when they go into the classroom, they're ready to learn, they're ready to excel, and they're prepared for success.
Yes. Absolutely. Welcome back to Families Matter. Joining us now to discuss the Affordable Care Act and what the district is doing to keep all of us informed are Dr. Kimberly Ueda, the Director of Student Medical Services, Community Partnerships, and Medical Health Programs, Irma Sanchez, a Senior Health Care Advocate, and Mary L. Gutierrez Kopkar, the assistant to the executive director of SEIU Local 99 Education Workers United. Welcome, friends. Healthcare and you. Dr. Ueda, tell us, what do we need to know about the Affordable Health Care Act?
Well, first of all, a lot of people don't know a lot about the Affordable Care Act. They think that it is something that won't affect them. But as you have said, Obamacare, it's here, it's now, and I think we deserve to tell our families that it's something that they should really be interested in. So the Affordable Care Act, or Obamacare as it's also known as, is really a huge transformation in healthcare. A huge transformation in healthcare delivery. It's the biggest thing that's happened in 40 years.
Wow.
It offers health insurance to people who might not have had health insurance before, and it's really designed to hopefully increase the health of all of our population so that we can lower the cost of healthcare, but more importantly for us, so that our families have access to exactly what you were talking about before, healthcare in communities where they find it convenient and it's high quality, and hopefully it prevents problems from happening later on.
Yeah, we need to prevent problems from happening. And we need kids to be healthy because we want them to be achievers. Mary, what is SEIU doing to help get the word out about this?
So one of the things that we realized is that a lot of our members, particularly part-time workers, not just here in Los Angeles, but across the country, really don't have access to healthcare because they're not working a full hour day. So a lot of what we've been doing, particularly here in Los Angeles, is working with Covered California to talk to our members that don't have health care and for them to pass on the information to their friends, neighbors, and people that they serve about, what are their health care options, when does the law go into effect. For those that may not be able to afford coverage, what are their options to be able to get subsidies from Covered California to be able to pay for it. And I think most importantly, letting people know that there's a deadline. You have until March 31st to have some form of health care coverage, or there are going to be penalties come tax season next year.
So March 21st?
March 31st.
March 31st, 2014. So from October 1, 2013 to March 31st, 2014, we need folks to come to the website, make a phone call, come close to our wellness centers somewhere, ask someone, can I get help? Can I get insurance? Is this something that's good for me and my family?
And how can I get subsidies to help pay for it if it's too much for me to pay for?
Very good, very good.
So I'm wondering what we're doing in the district. They're saying, why the district? What are we doing in LA Unified to help with this process?
Well, I think one of the best things is that our kids are in LAUSD. So if the kids are in school, our parents are involved in school as well. So that we go out in the CHUMP program, we go out, we do workshops, presentations to parents in multiple languages, so English and Spanish primary, but we try to educate them of what is Covered California, what are the penalties, what are the benefits, where can they get help, and we're available in person and on the phone, so we provide all kinds of services in order to get them to enroll, in order to get them educated at the pros and cons, but there's also other services available, like if they don't qualify for Covered California, there are other options, like the state-sponsored programs. We're still continually working with Medi-Cal to get the children enrolled if they don't qualify. And we try to find something even for the parents, either through Covered California or through the county. So we do provide the assistance in person, like I said, and we do provide assistance over the phone, so they can just, like it's a simple phone call away, they can get the information, English and Spanish. In order to get the word out, we do send out our staff to do educational workshops throughout the district, to be active in the community, to participate. Like we have a program right now. It's kind of a pilot that is going to start with our public libraries. So they will be out there spreading the word. We also conduct enrollment assistance over the phone and in person. So we're in our wellness centers, we're out there in our parent centers, so everywhere trying to spread the word and trying to teach them and guide them through the process.
This is really a historic moment, right? I mean, never before, 40 years of no change. This is change. And Dr. Yeda, why would somebody not want to participate?
Well, that's a good question. I think that if we had the answer to that, we might be able to crack through the, ceiling of what we see. As you know, we have lots of people, some children, but also adults, who are actually eligible for health insurance, not just Covered California, which is the marketplace in California, but for Medi-Cal. And they choose not to enroll. And I think that, our programs have had a lot of experience. People are a little bit fearful that maybe their citizenship status or their legal residency might interfere with their ability to apply. But for kids that are born in the United States, as well as legal California residents, there is a plan, there is something for you, either in Medi-Cal or in the new Covered California insurance products. And so I think that's a very important thing, because you ask a perfect question, which is why wouldn't somebody want to, participate in this? The other reason that we've been hearing is that there is some concern about the cost of these programs. Some people who may not be used to paying premiums for health insurance might find the costs a little off-putting. But as Mary said, the federal government is going to subsidize the cost of the insurance programs for people who can't afford it. So there's a lot of options, and we just want people to know that there's help out there.
And out of the 50 million people that qualify in California to be a part of Covered California, they estimate that about half would actually qualify for financial assistance in paying for their health care. So we're hoping that getting that information out is really going to make people feel more welcome about really looking into it, because there's a lot of fear, right? There's a lot of fear that, wow, healthcare has been out of reach for so long, why is it any different now? So I think the education that we're all doing is really helping really combat those myths.
And I think that's a very important part of it. I mean, educating our public, educating our parents, I think is going to make the big difference.
I also understand that some children and adults who had pre-existing conditions who
Right.
have not been able to get any insurance are now able to apply. What does that mean?
Well, I mean, I think the new law across the nation has been, again, very transformative. So whereas insurance companies could deny you coverage or say, oh, you now have a condition that we don't want to continue to cover you for, that is not possible under the new laws, under the Affordable Care Act and Obamacare. And so what we see is that there needs to be a lot of education, because certain people may have already tried to apply, had a pre-existing health condition that would prevent them from getting the best type of insurance. And they need to be told that there's possibilities for you to get insured now. And that's a wonderful, option. The other thing that comes with Obamacare is many people are taking advantage of this, is that your children can stay on your health care insurance up until the age of 26.
Right.
So there's just wonderful opportunities that people, again, if they knew about it, I think there would be a lot less resistance to signing up for some of these programs.
And you said, in terms of the immigration question, if any citizen or permanent resident is eligible.
Yes. I will defer to the legal experts, but in general, if you are a legal resident of California, you can apply for Covered California and see if you qualify for any of those plans and the federal subsidy that will help decrease the cost of those plans. Certainly, people who don't have legal immigration status, there are some restrictions, but for the most part, if you're legally a resident here, I think these are wonderful options for you.
And anybody have an idea, if I'm part of a family where maybe some people have residency and some people don't, or some people are citizens and some people aren't, how does that affect my family? If I am born here and I want to register, but not my family, not everyone
Well,
in
we
my
do
family
have families like that throughout this California, right? We're immigrants. So it is the fear, and maybe not knowing and not being totally documenting and educated on it. It's like there are some programs, even if mom and dad, for instance, are undocumented, don't have any legal status in the country, they're kind of holding back because they don't have the information, and they know that they can apply it and qualify for their children. If they're legal residents or U.S. citizens, they can still apply. And even for mom and dad, there are some level of coverage under different programs. So it's just like losing that fear, just getting out there and asking for the information and being educated on it. So don't hold back because you don't have any legal status in the country. There's always something, there's always an option.
The bottom line is call one
Yes.
of the numbers in our district, or call, there's other numbers available through the state and federal, I understand, and ask these questions and speak to somebody. I know it's also web-based, and I know that there's other ways of doing it in person, but find somewhere where you can talk to someone to find out, right?
Yes, please call us. We're available 5 days a week. I'm sorry. I mean 7 now that we're out there in the community, but yes, our staff is always ready and willing to assist and answer all the questions. And we might not have all the answers, but we can always lead them in the right direction.
So what would you say for the folks who want to explore this, maybe they are eligible, how can they actually come and find out about the program?
Well, they have different options. One of them, just get on the phone. There's toll-free numbers, either in the district or through Covered California. There's toll-free numbers, and or they can get on the web, and they try to make it like very user-friendly. to navigate and get the information. Just click a button and the assistance is right there. Or feel free to talk to one of our staffs that are going throughout the district providing the information and handing out the ARCHAM card that has a toll-free number.
Yeah.
So
yeah.
different
Exciting.
ways.
Exciting. We need folks to come to our schools, ask a question, figure out if this is something for you and your family. We're looking forward to 100% attendance.
Yes,
and we're looking forward to 100% graduation. So we need 100% of the folks signed up for healthcare. I think that's our new goal. What else should we tell folks about this?
Well, I think one of the interesting things about Covered California, which is the marketplace in California, is that they sent out, they specifically funded grantees to do outreach and education. And LAUSD was one of them, as is SEIU. And we're really committed to getting out this information. And one of, I think, the interesting things is that we were approved to do a student pilot with one of our partners, the LA Trust for Children's Health. And what that allows our students to do is to be trained student leaders in the area of healthcare information. And so we're targeting 2,500 high school students to really take these messages into communities in a culturally and linguistically sensitive way, talk to their families, talk to their friends, and say, hey, you can go onto the website, you can call this number, and let's figure out if this is right for our family or for our group of friends. And we think that students can be the biggest advocates for this type of change. They're really living through an incredible opportunity here, and what better sort of messenger than the kids themselves, many of whom can actually benefit from these new programs.
So what's the message to those individuals to help people get closer to this program? What do we want them to hear?
I think we want them to hear that it's accessible and it's safe. I think a lot of the feedback we've been getting is people have, memories of back in the 80s when we had immigration reform passed, right? And you had all these, how would you say, shady lawyers come up and say, I can, adjust your immigration status. We've been getting a lot of questions from folks saying there's a new, agency that's opened up in my community. I don't know if I should trust them. And I think the important thing to remember is that we're all going to see just little shops opening up in our communities. And I think it's very important that when we interact with these folks that we really make sure that this is Covered California, that we make sure that we're going to someone that is safe, that isn't going to rip us off, that isn't going to sell us something that isn't valid or is not really worth much. So I would caution on the side that, who we contact and who we reach out to is important. And that should either be the district or it should be Covered California directly to make sure that, we are being provided with the tools that we need and not someone trying to make money off of us.
I'm wondering that families get that message and because there'll be money exchanged to really find out that
Well, the
different
assistance
places.
is free.
You
It's
should
free.
never pay for assistance to enroll into a program. These government benefit programs or these partially government-sponsored programs, you should never have to pay somebody to help you enroll.
Right.
So we want folks to hear that there is free available information for assistance on the Obamacare. And when you hear from our kids who come and need medical or mental health services, what are those kind of things that they need help with?
I mean, it runs the gamut. I mean, I think that when we look at what we see in our school-based health centers, there are a lot of unmet needs out there. And that's where Obamacare and the health insurance packages that we're offering can really help us. Because built into the law is prevention. Built into the law is you don't get charged for immunizations, you don't get charged for mammograms, you don't get charged for screening. So we're hopefully going to decrease the amount of kids that show up to school with maybe some unidentified oral health problem or some unidentified vision problem or possibly some issues around mental health that have never been identified and taken care of. So I think what we see is something that we hope we don't see in the future. And the things that I mentioned are the things that show up at school. Kids that just don't have access to dental care, vision care, mental health care, or just straight primary care are showing up to school with conditions that are completely preventable. And we're hoping that that's the end of the preventable problems that we see with the advent of access to health care.
And what might happen if a student is not feeling well at school? What do you think, how does that play out?
You know, it's interesting as we're talking about health and mental health, sometimes it's hard to decipher it. It looks like a health problem, it could be mental health. So I think that they may go to the school nurse's office, they may have problems, you know, at home. So I think that what's important is to know that they could be both related and get help at the school. I think for whether it's a health or mental health, parents can come to the schools and find out, where can I take my child, what resources are nearby. Many schools don't have the resources, but find out where you can go.
Yeah, yeah. And I'm imagining some kids, when I don't feel well, I just don't want to be in class and I can't pay attention, right?
It's hard. It's not easy. I mean, it sounds simple, but it's not. I mean, and this is like, it can be a pattern that is like, okay, I'm feeling bad today, I can't learn. So you're falling behind and you're kind of pulling back everybody. So I think it's the same thing with parents not having medical insurance. And if all of us don't have it, in a way it's affecting us too.
Yeah.
It's affecting everybody. I mean, for better or for worse.
Right.
So might as well get it. Might as well join us.
And you said it, you can't learn. It's really hard for a student to be at school and pay attention and deal with classmates and teachers when you're not well, headache, toothache, stomach ache, or general anxiety, right? So what we're talking about is a way for our kids to get the help they need so that they can be successful in school. At least I think that's what, for LAUSD, Obamacare means more kids get to graduation.
Exactly, exactly. And I think that everybody around the table here agrees that access to health care is, you know, one of the fundamental keys to attendance and succeeding in school. So we're really committed to that. And I think that that's why we're so excited about the possibilities.
And we're all working together. I think that's the exciting thing. Health and mental health and teachers and administrators and board members across the way. I think let's all make this happen and really get health for our children.
So the law exists. This is the law of the land. Obamacare is here. And it's available for.
And it's here to stay.
Did you say 50 million people in California?
50 million people in California, half of which estimate would be qualifying for subsidies.
So easy million in LAUSD.
Yes.
We have a lot of work.
Lots of it.
Well, thank you for joining us on Families Matter, and please visit our family websites, family.lausd.net and parentaccess.lausd.net. Your involvement makes all the difference. See you next month, and remember, families matter. Thank you so much.
They matter to the healthcare, that's for sure.